First test we're going to do is joint line palpation. So you're going to place the patient in about 90 degrees and you're just going to systematically go around the joint, knowing that the patellar tendon's here. So if I get on the joint surface and I'm just asking Eric if he has pain as I go around. Now what's going to happen here is I'm going to pick up the medial collateral ligament all through here. So even though I'm palpating the medial joint line, I'm going to know that I'm over a lot more than just the meniscus. Okay? So I just go systematic. If you palpate both sides at the same time, the patient says, ouch, you're like, what side? So it's like, I usually do this and then I stop. And I go around. And then I got to dig around the hamstring and get into the joint line as much as I can deep through the popliteal region. And then I go the other way. You can usually appreciate where the LCL is in here and get around it and work your way back through the posterior lateral corner. Again, now I got to get around biceps femoris, slide underneath it, and get in the popliteal region. Okay, and you just basically systematically go around the ring. Okay, so just because it's positive doesn't mean they have a meniscus tear, but if joint line palpation is negative, that's a pretty good sign that they might not have one. Okay, its sensitivity rules things out a little bit better. Okay, all right. Next up, we're going to do McMurray's. McMurray's test is going to be start in full flexion and full flexion. So hip flexion and knee flexion. And what I need to do is I need to create a compressive load. So I'm blocking up here. I'm not on your patella, but I'm on the distal femoral condyle, so I can create a compressive load between his tibia and his femur. And I start in full flexion, and then what I'm doing is I'm going to grind like I mean it and load. And you'll see people do like swirls and arcs. I had a doctor call this the half moon grind. He'd externally rotate and grind an external rotation. He'd internally rotate and grind an internal rotation. And you basically, this is a test where you have to work. It's like a big isometric contraction of your core, and I'm compressing as hard as I can because I'm trying to imitate Eric's body weight. When I get out here to 90, I'm done. Okay, because most people are going to tear in the posterior horns. So I'm going to pick up those meniscus tears back here. Okay. Once I get out here, the test is, that's not how it was originally designed.
Positive is out and where?
There'll be a thunk, a clunk, and you can, many times they'll localize. But usually it's just something they say. Now I'm going to do Apley's. Apley's compression test is loading this way. So I'm loading into the femur through the tibia, and then I got to figure out a way to create internal and external rotation with that load. So a lot of people get the compressive load through the calcaneus, grab the tibia and fibula, and grind that way. So when I document that, I say Apley's at 90. Like Apley's with the parentheses 90. And I can modify Apley's like, I don't feel anything. What happens if I flex you more? So now I can bring them closer to like, you can do 100, 10, you know, work your way. But a lot of people will go up like to where Eli's test gets tight, and so I'm right at end range. And then I can do internal rotation and external rotation in that angle. And then I would document positive Apley's at 120, okay, for posterior pain or whatever the case may be. Okay, so those are the ones you can do on the table. And then we're like, hey, let's get smart. Let's test the meniscus and weight bearing. Okay. So the first test that came out was the Thessaly. So with handheld support, so let Eric put his hands on a knee so that he has balance. What you're going to do is you're going to weight bear on one leg, and you're going to flex your knee down to at least 30 degrees, so you're getting some load. And what you're going to do is pretend there's a pencil here and try and drive your knee joint itself through circles, so it's not just wiggling up at your hip. It's got to be down here. So if I train you a little bit, and then I get him to load more by putting more weight into his leg by doing single leg. There you go. And you can go clockwise, and then you can go counterclockwise, because if you have a flap tear, you might pick it up on one direction and not the other, just like we talked about in the labrum when we were grinding the labrum. Okay. So that's Thessaly. Then we have the Ege Test, EGE. Okay. So if I want to kind of compress the joints, if I get you into abduction, toe you in, and then when you squat, theoretically I'm going to load more the posterior lateral side, so I get a little bit of lateral meniscus because I'm opening up here in valgus, coming down that way. And then if I externally rotate, and squat and try and keep myself in varus. This is harder. I can't do this. I don't have range in my hip. But try and load them inside.